Imagine this. You are home alone. Suddenly, you feel a heavy pressure in the center of your chest. Your breathing becomes difficult. Cold sweat appears on your forehead, and the discomfort begins spreading toward your arm, back, neck, or jaw. You tell yourself, maybe it's just indigestion. Maybe I'm only anxious. I'll wait a few minutes and see if it goes away. But those few minutes could be the most important minutes of your life. A heart attack does not always begin with dramatic, crushing pain. Sometimes it starts quietly, with unusual tiredness, nausea, shortness of breath, dizziness, sweating, or mild pressure that comes and goes. And when you are completely alone, knowing exactly what to do can make a critical difference. In this video, you will learn 3 emergency actions to take immediately if you think you are having a heart attack while alone. Stay until the end, because I will also expose a dangerous internet myth that could waste precious time during a real emergency. Welcome to Dr. Vitalis Health. This video is for general education only. A possible heart attack is a medical emergency. Do not use an online video to diagnose or treat yourself. First, recognize the warning signs. Before discussing the 3 actions, you need to recognize what a heart attack may actually feel like. The classic warning sign is pressure, tightness, squeezing, fullness, burning, or pain in the center of the chest. The discomfort may last for several minutes, disappear and return, or gradually become worse. But chest discomfort is not the only warning sign. You may also experience pain or discomfort in one or both arms, pain in the back, shoulder, neck, jaw, teeth, or upper stomach, shortness of breath, with or without chest pain, cold sweating, nausea or vomiting, lightheadedness or sudden dizziness, an unusually fast or irregular heartbeat, or overwhelming weakness and fatigue. Some people, especially women, older adults, and people with diabetes, may experience less obvious symptoms. They may feel extreme tiredness, indigestion, nausea, back pain, or breathlessness without severe chest pain. That is why you should never wait for your symptoms to become dramatic enough. Even when you are unsure whether it is truly a heart attack, treat unexplained chest discomfort or a suspicious combination of these symptoms as an emergency. Now, here are the 3 actions you need to remember. Action number 1. Call emergency services immediately. This is the most important action in the entire video. Do not call a friend first. Do not search your symptoms online. Do not wait for the pain to become unbearable. And do not attempt to drive yourself to the hospital. Call your local emergency number immediately. Put the phone on speaker so you can keep your hands free. Clearly tell the operator, I am alone, I have chest discomfort and difficulty breathing, and I may be having a heart attack. Give them your exact address, apartment number, floor, entry instructions, and any nearby landmark that could help responders find you. Then follow every instruction the emergency operator gives you. Many people hesitate because they are afraid of being embarrassed if the problem turns out to be something less serious. But emergency professionals would rather examine you and discover that it was not a heart attack than arrive after you waited too long. Calling an ambulance is usually safer than driving because your condition can suddenly worsen. Your heartbeat could become dangerously irregular. You could lose consciousness. Your heart could even stop beating. An emergency medical team can begin evaluating and treating you before you reach the hospital. They may monitor your heart rhythm, give appropriate emergency treatment, communicate with the hospital, and respond immediately if you develop cardiac arrest. Driving yourself removes all of those protections. Even if the hospital is nearby, do not assume that driving will be faster or safer. Call first. Every other action comes after this one. Call first. Do not drive yourself. Action number 2. Make yourself accessible and reduce the strain on your heart. Once emergency services have been called, stop whatever you are doing. Do not walk around gathering belongings. Do not climb stairs. Do not try to finish a shower, clean the room, or change your clothes. Physical exertion forces your heart to work harder at a time when part of the heart muscle may not be receiving enough oxygen-rich blood. Sit down and rest in a comfortable, supported position. You may sit on the floor with your back supported and your knees slightly bent, or sit in a stable chair if getting to the floor is difficult. Do not stand unnecessarily. Do not pace around the room. And if you feel faint, avoid walking. Keep your phone beside you with the emergency operator on speaker. Because you are alone, responders must be able to reach you. If you can do so safely, without significant walking or exertion, unlock your front door. If you live in a secured building, give the operator the entrance code or instructions for contacting building security. If a trusted neighbor or nearby family member can reach you quickly, send one short message. I may be having a heart attack. Emergency services are coming. Please come to my door. Do not spend several minutes calling multiple people and explaining the entire situation. Your emergency call and your safety come first. If you have pets, only secure them if you can do it without physical effort or delaying emergency care. Then remain as still and calm as possible. Try taking slow, gentle breaths, in through your nose, out through your mouth. This will not remove the blockage causing a heart attack, but it may help you avoid panicked, unnecessary movement while you wait. Remember, resting is not a substitute for emergency treatment. It is simply what you do after help has already been called. Sit, rest, unlock the door, stay on speaker. Number 3. Follow the operator's medication instructions. After you have called emergency services and placed yourself in a safe resting position, the operator may ask about your medical history and medications. They may advise you to chew aspirin. Aspirin can reduce the ability of platelets to form or enlarge a blood clot, but aspirin is not safe or appropriate for everyone. You may have an aspirin allergy. You may have a bleeding disorder. You may be taking certain blood-thinning medications. You may have previously been told by a healthcare professional not to take aspirin, and not every type of chest pain is caused by a heart attack. That is why you should call emergency services first and take aspirin only when the emergency operator or a qualified medical professional recommends it. Do not take aspirin and then wait to see whether your pain improves. Aspirin is not a pain test, and feeling slightly better does not mean the emergency has ended. Follow the exact dose and instructions given by the operator. If you have been prescribed nitroglycerin or another medication for angina, use it only according to your personal prescription and the instructions previously given by your doctor. Never use another person's nitroglycerin. Never take extra doses, because the first dose did not immediately remove the discomfort. And never combine medications based on advice from a social media comment or an old internet post. During a possible heart attack, the emergency operator's instructions are more important than anything you remember seeing online. Aspirin only if advised. Use prescribed medications as directed. Cough. The dangerous cough CPR myth. Now we need to discuss a dangerous myth. You may have seen posts claiming that if you are having a heart attack alone, you should repeatedly cough forcefully and breathe deeply to keep your heart beating. This is often called cough CPR. Do not rely on this technique. A heart attack is usually a circulation problem caused by reduced or blocked blood flow to the heart muscle. Cardiac arrest is different. Cardiac arrest is an electrical emergency in which the heart suddenly stops pumping effectively. Repeated coughing has not been proven to treat a heart attack or to replace emergency medical care. In limited hospital situations, a medical professional may instruct a monitored patient to cough during a specific abnormal heart rhythm, but that is not the same as a person treating themselves at home. Trying cough CPR could distract you from the action that matters most, calling emergency services immediately. If you collapse and become unresponsive, you will not be able to perform CPR on yourself. Your best protection is making the emergency call early, keeping the line open, unlocking the door, and allowing trained responders to reach you as quickly as possible. What you must never do. Let us quickly cover the biggest mistakes people make. Do not wait for the symptoms to disappear. Heart attack symptoms can come and go. Temporary improvement does not prove that you are safe. Do not drive yourself unless emergency transportation is genuinely unavailable and there is absolutely no safer option. Do not take random medicines, antacids, painkillers, herbal remedies, or someone else's prescription medication cannot safely rule out or treat a heart attack. Do not take a shower or bath. You could become dizzy, collapse, and make it more difficult for rescuers to reach you. Do not lie down and try to sleep it off. And do not worry about whether you are overreacting. When heart muscle is being deprived of blood, delays can increase permanent damage. Fast evaluation gives medical professionals the best opportunity to restore blood flow and protect the heart. Prepare before an emergency happens. The best time to prepare for a heart emergency is before you experience one. Save your local emergency number in your phone. Keep your address and essential medical information easy to access. Know the names and doses of your medications. Keep a list of your allergies. Make sure at least one trusted person has a spare key or knows how to enter your home during an emergency. If you have diagnosed heart disease or angina, ask your doctor exactly what you should do if chest discomfort begins. Ask whether aspirin is appropriate for you. Ask how and when to take your prescribed nitroglycerin. And consider learning CPR and how to use an automated external defibrillator, or AED. That knowledge may one day help you save someone else. Final recap. If you believe you may be having a heart attack while alone, remember these 3 actions. Number 1. Call emergency services immediately. Do not drive yourself. Number 2. Sit and rest. Keep your phone on speaker and make sure responders can enter your home. Number 3. Follow the emergency operator's instructions about aspirin and any medication prescribed specifically for you. Do not wait. Do not rely on cough CPR. And do not assume that mild or unusual symptoms are harmless. Sometimes, the person who survives is not the person with the mildest heart attack. It is the person who recognizes the warning signs and acts without delay. Share this video with someone who lives alone, because the information they learned today could protect them during the most frightening minutes of their life. Subscribe to Dr. Vitalis Health for clear, practical health information designed to help you make safer decisions. Your health matters, and in an emergency, every minute matters.